Hi, everybody. This is Jennifer Kimball, and this is my presentation on my volunteer time at Valley Community Healthcare. So Valley Community Healthcare is located in North Hollywood, California, in the heart of Los Angeles' San Fernando Valley. They provide a much needed service to the community's population, particularly the female population. The clinic specializes in a range of obstetrics and gynecological services for female patients age 13 and older, including family planning, prenatal care, preventative screenings, appropriate medical treatment, and culturally sensitive follow-up support. All services are confidential, which is really important for a young man or a young woman. And the clinic's teen program consists of specifically trained peer providers and offers reproductive health and infectious disease counseling. One of the reasons why this clinic is special to me is because it's actually where I started my career as a nurse. I worked there from the time I was 17 until I was 29. So I worked there for quite a bit of time. I worked there through the whole time I was in nursing school, and then I stayed there for 2 years after I became a nurse to give back my services to the clinic. So it was really nice to be able to go back to the clinic and spend some time there. So the background and significance is that in November of this year, the Centers for Disease Control, the CDC, released their 2014 Sexually Transmitted Disease Surveillance Report, which has reported a significant increase in reported cases of 3 very common STDs: chlamydia, gonorrhea, and syphilis. In 2014, 1.4 million cases of chlamydia were reported, and which accounted for the highest number of annual cases of any condition ever reported to the CDC. There were also substantial increases reported in the rates of syphilis, 15% increase, and gonorrhea, a 5% increase. The majority of these cases were attributed to young people between the ages of 15 and 24, which is the biggest population for women's health that the clinic serves. And according to a statement made by Gail Bolin, who is the director of the CDC's Division of STD Prevention, increasing rates among men represent a large part of the overall increases in all of these STDs. So conversely, according to a report published by the California Department of Public Health in July of 2013, the teen pregnancy rate for the state of California was 28% and 32.4% for Los Angeles County, which puts the county in the top 20 of the state, but is a downwards trend from previous years. And California's teen birth rate is lower than the country's overall. So what this tells me is that adolescents understand the importance of pregnancy prevention, but not necessarily their safe sex practices may not necessarily extend to STD prevention. So Healthy People 2020 objectives. So STD prevention is actually one of the goals for Healthy People 2020, specifically to reduce the proportion of females aged 15 to 24 years with chlamydia attending family planning clinics to 6.7%. So this is based on data which states that 7.4% of females aged 15 to 24 who attend family planning clinics in the past 12 months tested positive for chlamydia, and this is data from 2008. Another goal is to increase the proportion of sexually active females aged 24 years and under enrolled in Medicaid plans who are screened for chlamydia infections during the measurement year to 70.9% for ages 16 to 20 and 80% for ages 21 to 24. So this is based on data that states that only 52.7% of sexually active females aged 16 to 20 and only 59.4% of sexually active females aged 21 to 24 who are enrolled in Medicaid plans were screened for chlamydia in 2008. Another goal is to reduce gonorrhea rates among female age 15 to 44 to 251.9 new cases per 100,000 people, per 100,000 people. So this is based on data stating that there were 279.9 new cases of gonorrhea per 100,000 females aged 15 to 44 in 2008. Lastly, another goal is to reduce sustained domestic transmission of primary and secondary syphilis among males and females to 6.7 cases per 100,000 for males and to 1.3 cases per 100,000 for females. This is based on data that states that there were 7.4 cases per 100,000 for males in 2008 and 1.4 new cases per 100,000 for females. So the syphilis rate for males higher than that for females. So the needs assessment. So over the course of the hours that I spent volunteering at the clinic, I noted that many of the young women would come in with very clear ideas of wanting a new birth control method. They may not have been clear on exactly what they wanted, but they knew they wanted to come in for birth control options. There was not quite as high a priority placed on STD prevention. And this was also where I found that education appeared to be, and their knowledge appeared to be lacking the most. So when I would ask questions to probe for their knowledge level in regards to STD transmission and prevention, it was not always as robust as I would have hoped. So issues, the education and practice. So to affect the STD prevalence and transmission rate, young men and women need to understand that the impact of acquiring an STD can have on their lives in the long term. So my experience is that, many of these women understand that pregnancy has lifelong implications, which obviously it most certainly does. But an untreated STD can also have long-term implications as well. According to the CDC, undiagnosed STDs result in infertility of more than 20,000 women each year. Pelvic inflammatory disease, or PID, which is a condition that results from untreated chlamydia, and this results because chlamydia often manifests with no symptoms, is one of the leading causes of infertility in the United States. And about 10 to 15% of women with chlamydia will develop PID. So the staff at the clinic also has to be informed that just as much time should be spent on STD education as is spent on birth control education. So a barrier is that these education sessions can take up to an hour and beyond when you're educating about birth control options and STDs all in one educational session. So the clinic flow can really easily become backed up, especially given the number of staff that the clinic has on any given day. So as with most community health clinics, funding is a constant issue for the clinic, and the clinic is chronically understaffed. According to Bolin from the CDC, this increase in STDs that's being reported can be attributed to cuts in funding to public health clinics. So to be able to perform these types of comprehensive education that's needed for many of these clients, the clinic would need to hire an additional 2 to 3 employees for each day that the clinic operates. So intervention. So my proposal to include comprehensive STD knowledge assessment and appropriate education to all clients are in line with the goals for the STD rate reduction and prevention that were set by Healthy People 2020 that we discussed earlier. In the educational sessions that I conducted, I started by assessing the current knowledge level of the client. So I would ask open-ended questions like, tell me what you know about chlamydia. And from there, I would tailor my education to each client's personal need. My education included the 3 major STDs that were mentioned in the CDC surveillance report: chlamydia, gonorrhea, and syphilis. At the end of each session, I would ask the client to restate the most important thing that they felt like they learned from me that day. As with any nursing care, obviously, it's really important with this population to not exhibit any form of judgment, regardless of what they're telling me about their sex practices. So regardless of how many partners they tell me they have, or how rarely they use condoms, and no judgment on my face, no judgment at all. It's important to keep them engaged and so that they listen to what I have to say. I also really did my best, being quite a bit older than most of these clients, not to, come off sounding like their mom. So budget needs. The clinic staff make an average of $12 an hour depending on how long they've been with the clinic. So each staff member costs the clinic approximately $13.8 thousand to $17.2 thousand per year in salary. And this depends on how many hours are worked. And generally, this is between 24 and 30 hours. The clinic operates 8 hours on Saturday, and then Monday and Wednesday evenings for 4 to 6 hours, depending on what the schedule looks like. So to hire an additional 2 to 3 staff to work only for the Women's Health 13 clinic, this will mean the clinic will need to spend approximately $41,000 to $51,000 a year on salary alone. And the clinic provides medical benefits, and I'm not certain what the cost of this is, so it would likely be more than that. So I know, though, that the clinic doesn't have this in their budget. So an alternative suggestion would be to either hire one additional staff member to conduct group classes on STD prevention, or to utilize an existing staff member. So these classes could be held weekly or bi-monthly and could last approximately an hour. The clients could be assessed at the time for a need for additional STD education that perhaps there's not time to conduct during the course of the clinic, and then could, be offered this class and, be signed up for it to come back later. So project evaluation outcome measurement. So my goals were to spend as much face-to-face time with the adolescent clients as possible, and to be able to have more clients tell me something that they learned than clients that were not able to do so. So although I didn't record this data, I can anecdotally say that I met my goal. There are very few clients that I was not able to engage. This is an area and a population that's near and dear to my heart, so I think that comes through. And the vast majority of the clients that I spoke with over the course of these weeks were able to tell me at least one thing that they took away from our educational session. So for the clinic to assess their success, they would need to first determine their own baseline data of what the current STD rate is within the clinic. Results and conclusions. So overall, I really feel like my time at the clinic has been successful. As unfortunately lobbying for increased state funding was kind of out of scope for me as a volunteer there, I can only propose these interventions that I've outlined. And again, I understand that the clinic's budget restraints may not allow for the implementation of the hiring of additional staff. As I said, as the clinic holds a special place in my heart, I have actually offered to help implement these group education sessions moving forward, and possibly lend my services as an instructor, at least in the beginning. Again, as for the hiring of additional staff, I don't know that that's feasible for the clinic right now. These are my references, and thank you very much for listening.